Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director, providing you the update from Albany Medical Center. Today is Tuesday, July 21st. All right, Fred, you have a good weekend?
Had a good weekend. How about you, Dennis?
It was good. It was hot.
Yeah, it was very hot.
It was hot. We did on Friday tape some of the segments that are going to be used in our Light Up the Night program. People may not know this. Light Up the Night's an annual fundraiser for the Department of Emergency Medicine.
It's a great event.
It was started by Vince and Luann Verdal well over 10 years ago.
Oh, yeah.
Yeah, for sure.
Yeah.
But this year it's virtual because of obviously group settings. But Brian and Chrissy from WGNA are part of that, and they were part of the taping on Friday, and they were great. So I just wanted to thank them for their efforts there.
Thank you.
Thank you very much, yeah. And that event's going to be a week from Friday, Friday the 31st.
31st of July.
Okay, very good. So let's jump in and look at some of the numbers for COVID. This is the graph of the capital region. You can see, Fred, in the hospitals in the 8 counties of the capital region, there are currently 35 people being treated for COVID-19. At one point, that number was 23, so that's come up a little bit, and it seems to be holding about there. So that's our number now, 35.
You know, Dennis, it's a large region, it's a relatively small number, and it's stable. So I think that's good.
Next graph is Albany Medical Center specific. Horizontal line, above that are admissions, and below that line are discharges or deaths. And Fred, you could see a couple days there where there was neither any admissions or discharges. In a couple days, there was a handful. I think yesterday we heard 3 coming in the door.
That's right. That's right.
That'll be reflected on the graph on Friday. And then this graph here is our morning census. Currently in the hospital at Albany Medical Center, we have 18 being treated for COVID-19, actually with COVID-19.
That's right.
16 on the floor, 2 in the ICU. That's the 18, a smaller number being actively treated.
And the same sort of thing, Dennis, as the regional numbers. So we fluctuate up and down a little bit, but we're kind of in a range. And not moving up and not really moving down towards zero.
One thing, Fred, that you've been focusing a lot on is congregate living people coming in from those settings. That number continues to be a number we're paying attention to.
Very much so. So I think today we have 73 congregate living folks in-house. And these are people here for all kinds of different medical problems, Dennis, not just for COVID, but because they're coming from congregate living, we've been handling them a little bit different. They used to have a conversion rate of about 20%. So while they were here, they would convert to being positive. That's dropped down into single digits, almost to the same level as the community incidents. So we're kind of changing how we're handling them. We'll talk more about that on Thursday. Once we make that policy change. But they're a population we're focused on.
For sure. Another thing that we've talked about in the past, and I think you want to give us an update, Fred, is on PPE. So personal protective equipment, masks, gloves, shields, etc.
So I want to start by assuring our staff that it is absolutely something we continue to focus on. I had a call at 10 o'clock this morning to get an update on where things stand. While we may not be burning through a lot of PPE right now because we don't have a lot of COVID, the rest of the country definitely is. So our supply group is very actively still trying to procure masks, PAPRs, shields, gowns, gloves, everything we need for our staff to function safely and to not infect our patients. So we continue to work on that. Right now we're in a good place, but it's kind of interesting, Dennis, how things are related. So we've started to use more shields and eye protection. Well, guess what? That means more wipes. And the disinfectant wipes have been on that PPE list that we've been looking for. So the group is actively trying to get more wipes in the door. So shout out to supply chain. They're doing a great job.
They sure are doing a great job. I've heard you mention it many times. Think about what is the next item that is likely to run short, and let's make sure we have that on hand.
And they're doing that.
Very good.
The other thing that I would say to our staff, be good stewards of our PPE.
Yes, very good.
It's important.
Mentioning staff, let's segue over to this topic. So we spoke about 100 in 100. If you missed that video, that's an initiative here on this campus to try to recruit and hire 100 nurses in 100 days.
That's right.
And I know that we're working very hard on that. We're going to continue to focus on that. This is a chance to say to you out there, if you're a nurse or if you're somebody who just wants to work at Albany Medical Center, we're hiring. So please go to our website. But what's the status on 100 in 100?
So Dennis, we're in double digits in terms of the number of nurses
great.
we've hired, and we've only been at this for a little less than 2 weeks. Shout out to Sharon Bessel, who's
Yes.
the AVP for Perioperative Services. She's jumped right into this and is going hammer and tong after nurses. Emily Wright and Kate Keefe,
Yes.
two other nurse leaders in the organization, they're on point as well for this 100 and 100. They've been pulling out data. I think tomorrow they have some group interviews. They're really working hard on this, so shout out to them as well.
All right, great. So great effort. Thank you as well, and we're going to continue to update that as we go forward. Last topic. We spoke last week about one of the service lines we spoke about, structural heart. And we said, let's talk about other services as we go forward. So today we're going to give a slimmer of talk about pediatrics. Huge topic, right?
It is,
but we're going to talk narrowly about some areas in pediatrics. Let's begin with this thing. We've been told that the number of pediatric visits during COVID went down, just like everything else. And I think, Fred, you're going to share some data with us in a second that shows that it went back up. But before we go there, I'd like to point out the fact that one of the things that went down were children coming in for annual visits and immunizations. And Dr. Rebecca Butterfield has pointed out that there's a certain sad irony of the fact that fear of the virus, coronavirus, was keeping children from getting the normal vaccination schedule for other viruses that could be prevented and diseases. So it's a good reminder to parents out there, let's make sure we get back in routine pediatric visits. Vaccination schedules, very important.
Vaccines are very, very important for your children, absolutely. So let's throw up a graphic.
Yes.
This is some data on the Children's Hospital. There are 3 lines. The top line is the census in the Children's Hospital, and you can see it dipped and has recovered, has come back up into more normative range. The middle line are the visits to our pediatric ED, and likewise, it dipped. That number is coming back. It's not quite back to where it was, but it has recovered in large part. The bottom line is interesting. That's the number of newborns. And if you look at that, you can draw a straight line across. That really hasn't changed. I guess if you're going to have a baby, you have to go to the hospital. You can't actually change that need that you have for that medical care. But we've done a good job with our newborns, and we will continue to do that going forward.
It's interesting, right? So to that point, women who are having babies had to come into the hospital.
That's right.
So there was no choice there. Yet we know that we delivered safe care to those mothers and to those babies.
That's right.
And it's a good example of when people could not stay out of the hospital, we were still able to provide safe care. And it's a reminder to everybody else, the hospital is a safe place.
Absolutely, Dennis. The hospital is safe.
So the last topic is perinatal, and so Steve Ross, who runs our regional perinatal center, sent us some information about that, which I'm going to share some statistics in a second. But Fred, just in general, when we talk about perinatal, what are we talking about?
So we're talking about the care around the delivery of a child. So prenatal is the portion of the care before the child is born. Postnatal would be after delivery. Perinatal encompasses both. So we're the level 4 NICU. We are the perinatal center. So a level 4 NICU is the sickest children. So those preemies, they all come to us. The perinatal center designation for us means we're a resource for other delivery units within our region. I think, Dennis, there are 17 or 18 hospitals that deliver babies within our region, and they look to us as the high-risk place, as the place to send preemies, as a place to transport mothers who are having problems. I think last year we had over 400 maternal transfers.
That's correct.
And 221 newborn transfers.
You got it exactly right.
So over 600 transfers from other delivery units to Albany Medical Center for care.
So the numbers alone are very impressive. And then you also have to remember that the people who are part of our academic program here are part of the quality improvement teams at those area hospitals. People like Dr. Michael Horgan go out and actually help with the quality programs there, which makes it great not only for here, but those other hospitals as well.
And your point, Dennis, they actually go to those other hospitals and participate and educate and help to improve the quality care provided at those smaller institutions.
So again, thank you to Steve Ross, the program manager for the perinatal team here. And thank you to the entire team. I'm so glad we could highlight their great work.
Yes.
Again, the Aries only level 4 neonatal intensive care unit. That's the
right.
highest designation, and great work by all of them, doctors, nurses, etc.
Busy place.
Busy place for sure.
Busy place.
All right, very good. Anything else today?
No, I think
That's
that covers it for today.
All right, we'll be back again on Thursday, Thursday. So we'll be back in 2 days. We ask that you please take care of yourself, take care of each other, and we'll see you in 2 days.